Localize acute MI in an ECG. That is very easy. Let's look. For lateral wall MI, remember L is the 12th alphabet. So V5, V6, 5 plus 6, 11. The remaining one, the lead one, and then this is lateral wall, L, AVL. V5, V6, lead one and AVL. These are the lateral leads. Here you can see the blood vessel that is supplying this region, and also please note that reciprocal change. I will explain it in later. Now for high lateral, you have to focus on that lead one and AVL. Then for apical region, you have to focus on that V5 and V6. Then inferior wall MI. For inferior wall MI, the inferior leads. Consider I as the Roman letter 1. So continuation of that 2, 3, and finally there is an AVF. These are the inferior leads. Now for anterior wall MI, you have to focus on V3 and V4. Then for septal wall MI, you have to focus on V1 and V2. Then there is a posterior wall MI. In posterior wall MI, we are actually looking for the reciprocal changes in the V1 and V1 to the V3. Now, what is meant by this reciprocal change? For example, consider the patient with a lateral wall MI. So you can see an ST elevation in the lateral leads. The reciprocal change means the opposite change. That means the ST depression can be seen in this 2, 3 and AVF. That means the inferior lead. This is the reciprocal change. Now you know.